What's up, y'all? Dr. Nate here. I'm going to teach you about degenerative disc disease today, degenerative joint disease. It's often called as well. So we're gonna jump right in. So I've got a couple things pulled up here. Let's see here. So I've got this paper pulled up. You can even just type this into your web browser, a brief review of the degenerative intervertebral disc disease. Also got this good one here. So I just wanted to read this really quick first off because a lot of people think that degenerative disc disease is just really bad and that there's nothing that you can do about it. But let's read this first before I go on to describe what it actually is. So if the disc injury progresses to the point of neurological compromise or limitations with activities of daily living, then surgical intervention may be required to decompress and stabilize the affected segments. But in the absence of motor deficits, which is most people, a non-operative course of analgesia, which is pain control, activity modification, and injection should be tried for several months. The surgical results for the primarily sciatic pain that has failed conservative treatments are predictable and favorable. So if you have degenerative disc changes that do have symptoms that go down the leg, it can be sometimes quite helpful to have a surgical procedure if you have not improved from conservative management. But what the heck is degenerative disc disease and degenerative joint disease? I can't even say those words. DDD and DJD for short. So essentially what happens as we age is there's a decrease in hydration of the disc, so a decrease in water content, and then also a loss of proteoglycans. And those proteoglycans are just kind of a filler substance that exists between the cells in an organism. So you can think of the proteoglycans that way. It's kind of the glue that holds everything together. So there's a loss of some of that. And I wanted to, so that's basically what it is from a cellular standpoint on a very basic level. But what's more important is understanding that this is a normal aging process. It's just a normal process that happens as we get older. And it's not something that's actually super tightly correlated with pain levels. So if I go over here, and I think you can still see this. I hope you can. So disc healing and its relationship to pain. So you'll notice here that with disc degeneration, 20-year-olds, 37% have some amount of disc degeneration, all the way up to 80% of people who are in their 50s. And then as we get older, 60-year-olds, 88% of people had some disc degeneration. And these people were asymptomatic. So 88% of the people that they took scans of, they took x-rays of, didn't have any symptoms. So yes, people who have more findings on X-ray and MRI typically have more symptoms, but they're not always tightly correlated to the exact presentation. So it's really important to get a clinical exam as well if you're going to be getting a X-ray or MRI or something like that. So anyways, just wanted to make this quick video. Please like or subscribe if this information was helpful for you, if it gave you some extra information that you haven't heard before. And the big takeaway is that you can and should go through a longer course of rehabilitation, even if you have severe degenerative disc disease, before getting surgery. And for surgeries where you don't have any leg pain, the results aren't that great. So that's why a lot of surgeons aren't even doing lumbar fusions anymore, because they just don't have great outcomes. There's not great solutions in terms of surgery for back pain that's just in the back, doesn't go down the legs. So just keep that in mind. Hope you have a great day, and I will see you next time.